Welcome to your Employee Benefits Introduction video provided by 208 Benefits. The information provided in this video is to help you understand your coverage options specific to your benefits that are effective in the benefit plan year May 1st, 2021 through April 30th, 2022. The RedTruck Disaster Response Employee Benefits Plan is a comprehensive benefit package that includes the following benefits: medical insurance and telehealth, medical bill services, prescription drug savings plan, short-term disability, accidental injury insurance, as well as dental and vision insurance. All full-time employees are automatically enrolled in the following benefits: medical bill services, prescription drug savings plan, short-term disability, and accidental injury insurance. The prescription drug savings plan provides you the following benefit. Through our partner CleverRx, we can help you save up to 80% off your prescription drugs for you and your family. No insurance is required. You simply download the RX mobile app to unlock your exclusive savings. Enter in group number 1144, member number 1000, and you'll be locked into those exclusive savings. 40% of generic prescriptions using the app are less than $10, which is oftentimes less than your insurance plan copay. Please use the app first when you need to fill a prescription for you or your family and to discover which is the better savings for you through the app or through your health insurance plan. Once you've located the correct savings for you, present the savings voucher to your pharmacist. Co-patient medical bill services. Medical bills can be surprising. Sometimes they can also have errors. We want to help you discover if your plan has errors, organize those bills, and advocate for savings on your behalf from your healthcare providers and payers. As an employee, the first thing you'll need to do when you're benefit eligible is go ahead and register with Co-Patient. You can find this from the Co-Patient tile in your Benefits Information Center. You click Account Login and it'll take you to the Register with Co-Patient screen. Once you click the button here, enter in your specific employer code, RTDR21, and then click Register. That'll take you in to create your own account. Once you've created an account and you have an explanation of benefits or bill, you can submit them using your smartphone, using a tablet, or a traditional scanner, and you can upload those into the document manager. Co-Patient will review your documents for errors, and they'll provide you a report showing you how many documents were reviewed, the number of cases you've submitted, and the potential savings that have been discovered and negotiated for you. Note is to please use Co-Patient before paying any of your bills. Short-term disability insurance. This is through Mutual of Omaha. Short-term disability protects your income if you're unable to work due to an off-the-job injury, illness, or maternity. Your short-term disability plan covers 60% of your gross weekly earnings paid to you in a weekly benefit. The benefits are payable on the 15th calendar day after your disability begins. The first 14 calendar days, you are responsible for those dates of lost income. Your benefit duration is 11 weeks per disability event. The only exception to that is maternity. Maternity benefit duration is 6 weeks for a normal delivery and 8 weeks for a C-section delivery. Accidental injury insurance. Again, another cash benefit insurance plan brought to you by Mutual of Omaha. What is accident insurance? Well, accident insurance pays a fixed cash benefit amount for diagnosis and treatment of specific injury events experienced by you or any family member that you've enrolled on the policy. The benefits received are not impacted by your medical insurance coverage or any other insurance covering the injury. Basically meaning the benefits payable to you are paid regardless of what those coverages pay or do not pay. How does the accident policy help you? We'll provide you 2 examples. First example is a minor injury. Just injured your ankle, no fracture. You have your doctor's visit, a couple of follow-up visits with an x-ray, and your policy will pay you a total of $375 for this type of minor injury. Example 2 explores a major injury where someone is injured in a motor vehicle accident, where they would experience a ground ambulance ride, ER visit, MRI, surgical repair of a lower leg fracture, 2 days in the hospital, walking boot, physical therapy. And here's illustrated where this policy could pay over $6,000 to you, the employee, to help you offset your medical costs, loss of income, and to make sure that you have money in the bank to take care of you and your family's needs. RedTruck disaster response employees may also choose to enroll in any of the following benefits: medical insurance with telehealth, dental insurance, and vision insurance. The following information will explore each of these benefits in further detail. Your medical insurance plan is through Trustmark. Your medical insurance network allows you to choose your preferred doctor, clinic, or hospital. You are not limited to a specific hospital or clinic or doctor. You may choose whoever you feel is the best fit for you. Before we go through your plan benefits, let's talk about some insurance terms. Copay. A copay is a fixed charge that a patient pays for every doctor's visit or prescription drug purchase. Example, in your plan you have a $40 copay for primary doctor's visits and a $20 copay for generic prescription purchase. Deductible. A deductible is the amount that you pay out of pocket 100% on your healthcare costs before your insurance company begins to pay. For example, your plan has a 0 individual and family deductible. Therefore, you are not responsible for any costs before the insurance begins to pay, outside of your copays, which we just explored. Your plan has an access fee. An access fee is the amount you pay out of pocket 100% for specific healthcare costs such as hospitalization or outpatient surgery. Your plan has a $1,500 access fee per specific healthcare event. The access fee applies to the plan coinsurance and out-of-pocket maximum. Coinsurance. Once you reach your plan's deductible, the insurance company will begin to pay a set percentage of all insured's eligible healthcare costs. As example, in your plan, once you've met your 0 deductible, the insurer pays 50% of all eligible healthcare costs. Out-of-pocket maximum. The out-of-pocket maximum is the most that you pay for eligible healthcare services in a benefit plan year. This includes deductibles, copays, coinsurance. All of those are combined to formulate the out-of-pocket maximum. As example, your plan has an out-of-pocket maximum of $8,150. Here's your medical insurance plan summary, which we've already discussed in specific detail. Your calendar year deductible, $0. Your plan coinsurance, 50%. Your copays, your primary and specialist doctor, your therapy visits, urgent care center, clinical preventive services are covered at 100%, and your prescriptions copays range from $20 for generic, $65 for preferred brand. Emergency room visit has a $500 copay. Your plan does cover 100% of outpatient diagnostic and lab, up to $1,000 in charges. Additional services with your Trustmark plan include telehealth services. Telehealth gives you the ability to talk to a doctor 24/7 via video using your smart devices. These doctors are licensed, board certified, and can diagnose and treat prescribed medications for many common illnesses, just like visiting a doctor in person. The great news about the virtual doctor's visits is that they are a $0 fee with no additional billing. Common illnesses that you can use your teledoc services for include seasonal allergies, upper respiratory infections, urinary tract infections, sore throat, earaches, upset stomach, rashes, bug bites, food poisoning, flus, coughs, colds, and many more. It's very simple. Once you've enrolled in your medical insurance plan, download the Teladoc app, add your medical insurance plan information as requested, and this will then save you time and money on your next doctor's visits. Additional member resources. Healthcare Blue Book. Healthcare Blue Book provides you the ability to discover what pricing is available for you for specific procedures that you may be requested to have from your doctor. Prices for procedures can vary up to 500% depending on where you go. So Healthcare Blue Book allows you to be able to price search those procedures using a simple online tool or mobile app that you can download. Once you've enrolled in your Trustmark plan and get your member ID number, you can go to the Healthcare Blue Book website and access the coverage using the company code Trustmark SB. Within this website, you will be able to search for your specific procedure that your doctor has asked you to have and discover where there are good pricing and also quality of care ratings. So please use this before you have any specific surgery or exam, procedure, to make sure that you're not overpaying for healthcare services. Additional member resources from Trustmark includes the AMPS Member Advocacy Plan. When you have healthcare services and they are processed through Trustmark, Trustmark will provide you an explanation of benefits. You will also receive a bill from your doctor's office. Your explanation of benefits illustrates what was billed by your doctor's offices, the charged amounts, any discounts, the allowed amounts, also what you may have already paid, including your copays, deductibles, coinsurance, and then giving you at the bottom your full patient responsibility. This is the dollar amount that you are responsible for. If you were to receive a bill that included your patient responsibility, included what the insurer also paid, and the doctor is asking you to pay above and beyond, this is called a balanced bill. If you think that you are receiving a balanced bill, or you are certain that you're receiving a balanced bill, connect with the AMPS team. There's an app that you can download or you can call them directly. Provide them the explanation of benefits, the bill that you've received, and allow them to work with that provider to resolve any additional expenses paid. Whatever the AMPS team provides for you with a negotiation with the provider is not your responsibility. Your only responsibility is to pay your patient responsibility portion that's on your explanation of benefits. Moving forward to the dental insurance plan. This will be with Beam Smarter Dental Care. Your plan provides an annual maximum benefit of $1,000. This is the most that the insurer will cover per calendar year per member enrolled on the plan. The plan does have a deductible. The deductible does not apply to preventive services. It only applies to basic and major services. The individual deductible is $50 per year. The family deductible is a maximum of $150 per year. Your preventive and diagnostic services, which includes your exams, your cleanings, your x-rays, are covered 100%. Your basic services, which also includes endodontics, root canals, gum disease treatments, oral surgery, is covered at 80%. Your major services, which includes your crowns, inlays, dentures, bridges, implants, covered at 50%. Additionally, with Beam, you can access Beam perks simply by enrolling in the plan and going to the website to register with Beam. You and everybody enrolled on your Beam policy will be sent a Beam Smart Brush, Beam Paste, and refilled Smart Brush heads every 6 months. The Smart Brush is a Bluetooth-enabled brush that you can connect to your Beam app on your smartphone, and you can monitor your and your family's brushing habits. In addition to that, the more persons underneath your group dental plan that use the Beam Smart Toothbrush and connect to their phones will reduce your future premiums. There are plenty of in-network dentists to access within the Treasure Valley. Vision insurance plan, also through Beam, utilizing the VSP network of providers. Your vision plan benefits allow you to have exams, lenses, frames, and contacts instead of glasses on an every 12-month period. Your exam is a $10 copay. Your materials, which is your lenses and frames, is a $10 copay. Beam provides you an allowance of $150 for your frames and then a 20% discount off the remaining balance. Elective contact lenses also receive a $150 allowance. Additional discounts and savings on lens enhancements, additional pairs of eyeglasses and sunglasses, and LASIK vision correction. Plenty of providers within the Beam VSP network for you to access. There are premier providers which provide you additional discounts and frame selections, and there are standard and network providers. The following will be a review of your benefit package contributions, what you pay per paycheck to enroll in specific benefits. As you see here, there are 4 columns: the employee-only coverage column, employee and spouse, employee and children, and then employee and family, which is basically employee, spouse, and children. You can enroll in any category that you choose on any benefit. As an employee only, your contribution per paycheck is $37 to enroll in the medical plan, which also includes the medical bill savings, prescription savings, disability, accident. To enroll in the dental plan and vision plan, you'll see your premium contributions per paycheck here. You can enroll your spouse and or children to any of the coverage options you choose, including accident, dental, vision, and medical. Now moving forward to your benefits enrollment, what are your next steps? Review your new benefit information. Contact 2A Benefits with any questions, and complete your online benefit selections. Reviewing your benefit information is on the website that you access this video, where you can see your benefit tiles, Simply click on the benefit tile and you'll discover more information about that benefit, including videos, benefit summaries, access to the specific insurer phone numbers, email addresses, and websites. Your benefit pricing is also on this Benefit Information Center, so you can review and access this before making your benefit decisions or reviewing back after you've made your benefit decisions. Once you've reviewed your benefits, looked at your pricing, please follow the instructions listed here on the Enroll Benefits tab. Watch the video here on how to enroll, and then click Go to the Benefits Enrollment Center button. Your enrollment deadline is the 15th of the month prior to your benefits renewal or employee benefit eligible date. Please ask your HR person what your benefit eligibility date is so that you know which the 15th of the month prior to complete your elections. Thank you. Please refer back to this video at any time. Reach out to us if you have any questions.